Hello everyone. This is Varsha, Gorey, Senior Clinical Dietitian, Apollo Hospitals, Navi, Mumbai. The topic which we are going to discuss is nutrition management for cancer patients. Now, when we talk about cancer, it's a lot of doubts related to diet, not only for the patient but patient's caregivers, relatives, and the surrounding many well-wishers. Yes, lot questions come, and the frequently asked questions are whether sugar is good or bad, whether fasting should be done, what type of water should we use, and whether we should fast, and what exactly we need to know. So I will try to resolve few things which comes in your mind. Maybe we can only touch base upon these perspectives, not get into the details. First of all, let's understand that in cancer, the therapy which they take, like for example, it is either surgical, radiation, or kind of chemotherapy, that itself is going to have some effect on the body. And based on the effect, we need to look at if there are any side effects. Then we need to plan the diet accordingly. Which part of the body is affected during your disease state is also important. Sometimes your digestion is impaired. Sometimes there is lot of nausea and vomiting. So if there is any nausea, vomiting, dehydration kind of state, first of all, the diet will be liquid, but there should be liquid in such a way that it is nutritious liquid. You need to correct the salts of the body. You need to correct the dehydration of the body. And at the same time, the patient is not able to eat. So we have to emphasize in small, frequent foods. In certain conditions, they are not able to bear the temperature. So correction of temperature. For example, if you have mouth mucositis, then the temperature correction, hot or too hot food or too cold food cannot be tolerated. So room temperature foods are better tolerated. Mouth gets dry. So our simple things are like eating bread and chapati doesn't work like what you and I will eat. So semi-solid diet, or if not a semi-solid diet, as simple as your crushed chapatis, rotis, multigrain, or whether the millets, it is better to use in that form. Mix it with your milk, dal, or a vegetables curry preparation. By and large, patients tolerate a mild diet. They are not able to tolerate a very spicy diet because either due to ulceration or either due to digestive issues, they find difficulty. Well, when they feel like eating spicy food, what they were accustomed to. So when they feel like eating such food, maybe just a spoonful of it, like what we give it as a small prasad or little quantity, just for the taste, can be mixed with curd or can be had with buttermilk, so that they are able to tolerate it much better. So it's not about what you should eat, but you need to make these changes, which are very unique for every patient, and not only unique for one patient, but this is going to change with his therapy. Now, one more point which comes to my mind is about very often we think, yes, vegetables and fruits are very important for patients and how much to eat. So instead of how much to eat, or let's not quantify, but let's give quality also. So give colorful vegetables: green, white, yellow, orange, red, purple. At least minimum 3, and good amount is 5 to 7. Tolerance as per the patient can eat it. At times, you may not be permitted to eat raw foods because you may have low neutrophil counts, or you may have diarrhea. So, in such cases, we kind of sometimes refer a neutropenic diet, that is a diet which has, when your neutrophil, your blood count is on the lower side post chemotherapy. So, such time you can give pureed fruits, stewed apple, so that the chances of infection, or pureed vegetables, mashed vegetables, skin removed, thick peels, like you have banana, orange, or just freshly cut fruits, not getting exposed. So these can be much safe and beneficial for patients. Before I close for the session, one more question comes to my mind. In fact, this question has been asked several times to me in our OPD and the admitted patient, that should the patients be fasting? Because fasting that is what I've been understanding through them, is that fasting helps to kill the cancer cells. Now, this is a total myth, because if you are fasting, then what happens is that body is already in a depleted state. There's lesser reserves, plus your requirements are higher. So when your reserves are less, requirements are higher. you are going to be in a deficit, you will be in a starved state. In fact, you will be more weak and immunocompromised. So, avoid fasting, but eat smart. Eat, include all the vegetables, fruits, in the required way. Include all the food groups. You can include nuts. Suppose there is a swallowing issue, then try to have nuts in a puree form, boiled cooked form, or its milk form. So important aspect is that include all the foods, and most important is that you reach to a specialized person for the advice you need, not once but during the routine visits, because every time the requirements are going to change, the type of diet, the consistency of diet, the complaints which you may have. So keep all this in mind and have healthy and safe eating. Thank you very much.